The article selected is Social Behavior and Mind Cognition Impairment in Early Dementia. It is important to understand what is deemed normal in behavior in aging individuals in order to properly care for and diagnose any cognitive or behavioral disorders or issues. Behavioral systems as related to dementia and mild cognitive impairment can be scary and troubling to understand and also handle. Mild cognitive impairment, also referred to as MCI, is an intermediate stage between the expected cognitive decline of normal aging and the more serious decline of dementia. Dementia is a chronic or persistent disorder of the mental processes caused by brain disease or injury and marked by memory disorders, personality changes, and impairment reasoning. The article analyzes a mixed group of participants that both exhibit these disorders that impair social behavior as well as individuals without any type of cognitive impairment. Both independent and dependent variables are introduced in the article in the forms of the participants suffering from dementia, mild cognitive impairment, and those not suffering from any type of impairment, and how these impairments or lack thereof influence social behavior, including social appropriateness, social inappropriateness, stereotyping, and prejudice. Individuals who exhibit any type of behavioral disturbances that are often seen in those suffering from dementia and mild cognitive impairment often have trouble with depression, anxiety, aggression, and other psychological factors. Too often disorders go undiagnosed or even unrecognized, so having a clear understanding of these disorders as well as the long-term impacts, including social behaviors, allow the individuals as well as the caregivers to be more prepared in handling the changes in behavior that come with the disorders. The case study included in the article took 107 participants from a variety of backgrounds and at different stages in cognition and incorporated 3 different assessments to evaluate how social behavior and functions are impacted with the introduction of the participants' cognition and behavior. The assessments used were both peer-reviewed as well as nationally used assessments that measure cognitive impairment, memory, and recall. Based on the assessment and the participants' current stage in their cognitive ability, there were visible shifts in their social behavior and memory. One strength of the study is that there were multiple assessments used, which aids in the author's perspective of visible shifts in behavior and cognition when there is dementia and mild cognitive impairment present. A weakness of the study is the use of the peer-reviewed assessment. Without fully understanding the individual's full knowledge of acceptable versus unacceptable behavior in older individuals, it is difficult to utilize their findings and opinions to support the study. Detecting cognitive impairment in older individuals is advantageous for the individual, caregivers, medical professionals, and medicine companies. The ability to assess the individual's function as related to their social behavior when their cognition is impaired is impactful in recognizing normal behavior versus behavior that is in need of some form of intervention.